Good evening and thanks for joining us tonight on Good Question. My name is Travis Coffman. I'm the host of The Big Show on News Talk K57. But tonight we take our conversation to you on television. A problem, a growing problem that the community is talking about is homelessness. Each and every year, the Homeless Coalition builds a large group of people to help count the homeless and find out more about the homeless. What do they find out and why? What are they finding out? Will we find any solutions? Well, we'll find out more tonight. Our special guest in the studio is Margaret Hattori. She's from the University of Guam, and she's the interim director of nursing there, but you've also been involved in homeless count for years.
Yes.
And we've talked about it before. And tonight you're going to tell us some new things that we can expect this year, and maybe even tell us how we could participate, right?
Right, exactly.
All right, fantastic. Okay, well, we're going to get to all of that and more, and there are some questions that maybe haven't been asked about homelessness, and we'll talk about it all tonight right here on Good Question. Stay with us.
Fox 6 takes Guam's #1 rated news and talk radio station, News Talk K57 to TV. Watch Fox 6 every weekday as our PNC cameras feature the live in-studio environment of The Breakfast Show with Ray Gibson, Patty Arroyo on the radio, and The Big Show with Travis Coffman on News Talk K57. Enjoy an entertaining televised look at Guam's most popular talk shows. Tune in to Fox 6 every Monday through Friday from 6 to noon, and then again from 4 to 6 to see what's on the radio.
Help make a difference in our community and join the fight against crime. Tune in to PNC News every Wednesday night at 6 on ABC 7 and on Fox 6 at 7 p.m. for the Guam Crime Stoppers Crime of the Week. Each week, the Guam Police Department will highlight an unsolved crime, hoping you may have information relating to the case. Join Crime Stoppers Coordinator Officer Paul Tapao every Wednesday night on PNC News for the Guam Crime Stoppers Crime of the Week.
Good evening and thanks for joining us tonight on Good Question. We've got Margaret Hattori with us from the University of Guam. Margaret, thanks so much for being our guest tonight.
No problem. Thank you for having me.
Oh, absolutely. This is, to me, a very interesting topic because lots of people see homeless people here on Guam, and we've got a lot of questions, and you've been involved in gathering information about the homeless population for a number of years. How did you first get started in this?
Well, actually, I had been hearing the call for several years to be a volunteer, and as a faculty in our community health course, I kind of like most people was a little bit hesitant, and I hate to admit it, I was even kind of afraid to volunteer. But then one year we had our students do an assessment of the village of Hagåtña. Every year in the fall, the students will pick a village, or we'll help them pick a village, and they'll do a community assessment. And this particular year, the students were very interested in the issue of homelessness. And so they talked to some of the homeless residents of Hagåtña, learned a lot, did a presentation, came up with some ideas, and started doing outreach through our Student Nurses Association. And so as the faculty advisor, I went with them, and then a group of them said, hey, let's volunteer. And so I agreed, and since 2009, we've participated in the count, and kind of the ball kind of started rolling. The students loved it. It was a great experience. And then we realized that the Homeless Coalition needed so many volunteers. And the success of the count, I hate to say it, is dependent on the bodies, the number of people we get out, because we're trying to cover the whole village in one day. And so when the students were so happy and eager to volunteer, I realized, okay, this is a great resource, and it's a great community service, and it also is a way for us to give back to the community, because the community helps us so much at the university as well. So I thought it was a really good opportunity, and we've just been participating ever since.
I can see why you'd be hesitant in the first place to talk to members of the homeless community and even be a little bit nervous. How does one even go about approaching someone that's homeless to start asking them questions?
Well, when we first started, I've done home care for a long time, and we teach community health nursing. So with our students, we go out and do home visits. And so it kind of comes naturally, you don't think about it. And so I approach them the way I would approach any client, any person in a home. You know, they're human too, right? And so you just say hi, smile, try to develop rapport, and have them realize that you're there to help. You know, if you're not smiling and you have kind of an aggressive stance, or or you're disinterested, and it's obvious you just want to fill out this piece of paper, then they're not going to talk to you. And so fortunately, we bring our senior nursing students, and they've already had a semester of public health, and they've also had a semester of psychiatric nursing, and they've learned how to communicate with different types of people. And so it kind of came naturally to the students, and they're excited about it. And it really is eye-opening for everyone.
Now, with the information that your nurses, your student nurses were gathering from the homeless population, what were they doing with that information? What do they need it for?
Well, the students are just a small part of the whole force, because I think last year we had about 155 volunteers.
And I'll get to that in a minute.
Okay. So for their assessment, what they were using that for in their course, they're supposed to come up with ideas based on the nursing process, based on assessment. You know, what kind of things would these clients need? What services would help them? And what are some of the problems in the village? And so every year the students will do this assessment at different villages, and we'll invite the village mayors to the presentations. And we're really happy this year the village mayors came and gave feedback to the students, and we give that feedback to the mayor, because it's really a good opportunity for them to talk to the village mayor and get out there and really learn what's going on in the village.
Oh, I see. Now, on the larger scale, there's something called the Homeless Coalition. What is that exactly?
The Homeless Coalition is it's a wonderful organization, and it's comprised of different GovGuam agencies, Department of Public Health, Guam Behavioral Health and Wellness. We've got representatives from GDOE also. And then the VA has someone on our coalition. We also have, of course, someone from GURA who spearheads everything and really kind of spearheads the grant efforts, the grant writing. So she's really vital in the whole the process. So GURA is we really rely on GURA a lot. Catholic Social Service, West Care, Salvation Army, Oasis. So you've got a really good blend of nonprofit and government agencies working together, and some private individuals also that are working together with the same goal to try to end homelessness.
Oh, I see. Okay. Now, there's something coming up that is the point-in-time count.
Right.
What is that exactly?
Well, HUD, the Federal Department of Housing and Urban Development, requires that we do a point-in-time count every other year in the odd years.
Okay.
But on Guam, we've decided to do it every year because we really feel we need the data, and it gives us a better picture. So what the point-in-time count is, in the last 10 days of January, the federal government requires that we go out and we survey the homeless, as many as we can reach in one day. And we call it a point-in-time count because since it's only on one day, it's really a snapshot. So it's never really a true picture. We're not going to get to every single homeless person in that one day, but it can give us a really good overview and even some good details about the homeless picture on Guam. Okay.
Now, to begin with, are we having more homeless people on Guam?
Well, that's always a complicated question because the total number did drop from 2012 to 2013. However, in certain villages, you can see real increases.
Really?
For instance, in Agana.
Yeah, there have been, I think, some noticeable increases in homelessness in Agana. Why is that, do you think?
Well, partially, I think some of it, I think, is the economy. We are seeing some chronic homeless, but then we notice in the last count we're seeing new homeless, and a lot of them, while a lot of them do have jobs, it's not adequate to pay the rent. And to get into a new apartment or get into a housing situation, there are quite a few that are homeless also. So we were surprised that we saw a lot of new homeless teenagers as well.
Teenagers,
families,
really?
And families as well.
Okay, well, my guess is that one of the chronic homeless problems, a lot of them have to do with substance abuse. With mental illness.
Right.
Just this week, our news people talked to someone who believed that he was able to flip cars with his mind, and ironically, a boat flipped on Marine Corps Drive, and I'm sure there's no convincing him that he wasn't responsible for that.
Right.
How does that contribute to the problem? Is that a reflection of our inability to deal with that as a community, mental illness, or
well,
what?
I mean, that's a great question, and it's complicated, and I think that's why the Homeless Coalition is comprised of so many organizations, so many people, because if we had an easy answer for you, the problem would be solved.
Yeah.
And so I think it's very complex. And one thing I really think we should focus on as a community is prevention. Because yes, while we have these services, if we don't stop the problem and we don't focus more efforts on prevention, we're going to constantly need these services. So we need to focus, I think, on both ends. The people that are already homeless, but then there's a whole bunch that are right on the edge. Exactly,
okay. Well,
exactly.
What are the sort of linchpins that kick people over the edge into homelessness?
Well, a lot of it is financial, obviously. And that when we talk to people during the survey, of course, a lot of them will say, you know, I lost my job. We met one man that has a family and he works part-time, but he had been in construction. And I met several homeless that had moved to Guam because of the perceived military buildup, right, and thought they were going to get construction jobs. So there is that element. So, you know, there's all these tiny pieces, right? So when you add it all together, there's a huge picture, a big problem. But that's one segment. And so he was in construction, lost his job, started getting a part-time job doing something else, has a child, had family problems, gone from family member to family member. And really worked hard to try. I mean, it was so heartbreaking because he was talking to me about, you know, trying to provide for his child, making sure she gets to school. The wife walks her a long distance to the bus stop every day.
Wait a minute. So there are homeless children that are going to school.
Yes, there's homeless families. Yes. And that's why I really think it's a community problem. We have people in the schools. Teachers need to be aware. The school health counselors are well aware. But I think if the population in general becomes more sensitive to the issue that there are families out there suffering, you know, you can't expect every child to come from every child is not a middle class child, and we all know that. But sometimes I think we're just not sensitive to those problems. And if we can reach those children, maybe we can end the cycle of homelessness for that family. And I really think that's an important piece of the problem.
You were telling me also that you're seeing more victims of domestic violence becoming homeless?
Yes,
how is that happening?
Well, and even nationwide, this is a problem. And in particular, when women, I'm not just picking on women, right? But because men are victims of domestic violence, but when you see women trying to flee a situation, frequently they leave, they leave the home, but they leave the financial security. So when they have to flee a situation, they don't have all those resources that they had before. And we see that frequently with women too who get a divorce. When the family separates, if the woman takes the children, that sometimes their living situation, right, the status decreases because of the lack of income, or the same level of income that they were used to when they were a married couple.
Dr. Margaret Hattori is with us tonight on Good Question, and we're talking about homelessness and the up-and-coming point-in-time homeless count. And she's chatting with us about her belief that preventing homelessness is one of the ways, and probably the key way, to really tackle this homeless problem, stopping it before it starts. We'll continue that discussion right after these.
Burn up the bandwidth. Guam's hottest talk comes to your smartphone with News Talk K57's streaming apps. The latest in news, weather, and talk in the palm of your hand. Plus, exclusive features let you talk back to us via email. Visit our webpage and see breaking news on PNC's Twitter page. Smartphone users can now download the free app, which will stream all day, every day, and anywhere. Look in your platform's app store for K57 and download it today.
Half a day, I'm Frankie Perez. Watch PNC Sports every weeknight on News Now for your comprehensive coverage on local sports. We'll keep you updated on your favorite local athletes here and abroad. Plus, we'll get you the best plays on the plays of the day. And every Friday night, we gather the best of the best and give you the plays of the week. If you're an athlete, we're watching out for you. And if you just love sports, well, we know exactly how you feel. PNC Sports, your lifeline for action on Guam.
Good evening and welcome back to Good Question. My name is Travis Coffman from News Talk K57's The Big Show. It airs every afternoon from 2 to 6 on 570 AM and in the afternoon on Guam's own Fox 6. We hope you join our conversation on the radio And that's where we've been talking with Margaret Hattori, Dr. Margaret Hattori from the University of Guam. And she is involved with the point in time homeless count and has been discussing with us at length her involvement with it, and actually hoping to enlist some assistance from the community in participating and helping out with the homeless count. What is it that you would like from the community?
Well, a couple things. It's not a lot, but I believe we still don't have enough volunteers. Last year we had 155, and I believe right now we're around 100. Although I came from training today and there's 30 people there and 30 yesterday, so I'm hopeful that we have enough. But if anyone's interested in volunteering, that would be helpful. The other thing is we're still looking for canned goods.
Okay.
We need canned goods to give to the homeless individuals when we do the survey.
What kind of canned goods?
I mean, we'll take anything, but we really like to have, you know, a vegetable, a fruit, and then some kind of meat product for the individual. So, I mean, canned goods aren't the most balanced, but at least you can have a balance there of the protein, the carbohydrate.
Okay, and I would imagine that's going to help out with filling out
Yes, filling
the
out
surveys.
the form. Exactly.
Okay. Now, I would imagine also that in participating in the homeless count over the past several years, that you've had the opportunity to get to know some homeless folks.
Right, right. It's helpful if we go to the same area. And so, yes, we're familiar with some of the same homeless that live in the same villages that we do our survey in. And that's helpful. Last year, I noticed, because it's been the third year in a row, they would recognize us and ask for more. They would open up a little bit more. And this year, you know, I got more specific requests for help.
Oh, I see.
Than the previous year.
Right, and they recognize you, they realize that you're out to help. There's nothing, there's no gain for you.
Right, right. And so, you know, I mean, some things were simple. You know, someone sleeping in a park and just asked for a comforter, just so they could lie in a comforter. There was an elderly woman too that needed help, and we made a public health referral. So things like that. Sometimes we refer to Salvation Army's Family Services Center. And of course, you know, on the unfortunate side, we do make referrals to Adult Protective Services and Child Protective Services. Now,
you've mentioned in the past, Margaret, something about the differentiating between the different types of homelessness, sheltered and unsheltered. What's a sheltered homeless person? If they're sheltered, are they not homeless?
Yeah. Right, right. Well, for the HUD definition, anyone on that day of the count that is residing in a homeless shelter. So one of our shelters on Guam, for instance, like our family shelter at Guma San Jose. So those people are the only people that count in the sheltered count. And in fact, earlier when you asked if the numbers were decreasing, our sheltered count dropped. And that has nothing to do with not needing shelters. It's just that our sheltered beds, the number of sheltered beds we had on that particular day had decreased because of change in some of the programming. And so it doesn't mean that we have fewer homeless in need of shelters. It's just that the beds, the physical beds that were available that day is all that we count for that day.
Oh, I see.
Right.
And is there are there a total number of beds that are available?
Well, at that count, I don't have it. On that count, I can't remember, but yes.
Just ballpark,
yes.
I mean, but there is, and that's included in the count, as in total number of slots that are available.
Sheltered was 204.
204.
In 2011, and it dropped to 128 in 2013. So that dropped.
Wow.
Yes, yes, because some of we had a program that changed from a sheltered situation to actually moving into affordable housing.
Oh,
yeah,
I see.
so that's what I meant by the programming. So money shift. So we lost those beds because some of the money went towards affordable housing, which is still important.
Right. It doesn't mean people aren't being helped, but not being helped at that level.
Exactly. So I hate for people to say, okay, the number dropped, so we have fewer homeless, when it's a little more complicated than that.
I see.
And we all know that there's a waiting list for the sheltered beds that we have. So we know that there are.
No, I didn't know that there was a waiting list for sheltered beds.
There's always a waiting list for sheltered beds.
Really?
Yes, especially in our shelter for families. And we only have one shelter for families, and that's in Dedido. So that leads to a host of problems, because if you take a family, let's say from Agana, you put them in Dedido, those children still need to go to school.
Right.
but what school are they from? They're not from a Dedito school.
No, so that's going to cause more problems from them. Not only are you living in a homeless shelter, you're away from the people that you know.
And we don't want to disrupt their education, because again, it goes back to prevention and maintaining the quality of life for the family.
Who are the homeless? People want to know, like, by ethnicity. It's like, what population groups make up most of the homeless?
Well, in this last count, in the last several years, the #1 population is still Chamorro, and the second is Chuukese. So it is significant. We are seeing a significant rise in the Chuukese population as well. But I want to make sure people don't focus. Sometimes people focus too much, I believe, on the FSM population, saying in error that they're the #1 ethnic group that's homeless, because it's still Chamorro.
Okay, so that's, for one, that's not true.
Right, and I think it diminishes the focus on the problems that Chamorros have that may lead to homelessness. So I really think we need to not stereotype and look at the different people that are homeless. We also saw an increase in homeless families. So I think the typical stereotype, right, is a male substance abuser that's living on the street.
Right.
I think that's the misperception.
And that's not always the case.
No, it's not always the case. That is a large portion of it, but in the last count, we did see more men, but still a significant number of females, only slightly less than the males. So you are looking at a lot of females, and you've seen it in Agana, a lot of female homeless.
This is true. And there also is a group of veterans that are homeless, and you were telling me the story the other day about folks that seemed to arrive at the airport destined to be homeless. What happened there?
Well, that report came from Diana Calvo from Catholic Social Service that she's experienced just this last week, partly due to the weather in the mainland.
Right, it's really cold there.
Right, I think she reported 5 homeless veterans had come to Guam, reported to her that they came to Guam and are seeking shelter. So,
and that's it, they got about enough money to get here, and that was it.
Right. But in our last count, the homeless that are on Guam, it's been consistent, 32, 33. And the VA does make a concerted effort to, and the other veteran services who are part of the coalition, make an effort to reach out to the homeless that are veterans. So we do make referrals when we find them to the VA to try to get them housed.
When I hear you talk about wanting to prevent homelessness, I think to myself, what resources are there that are available? What number do I call to go, hey, I'm about to be homeless. I'm about to be a total full-on burden to society. Throw me a bone here. It seems to me that resource doesn't exist, or does it?
Well, it does. I mean, there are different resources for different types of situations. You're right. But I mean, I think if we think broadly about prevention, I think you need to even go further back.
One step back. Okay.
Right. I had a homeless individual who's I would say in his late 20s, early 30s. And he told me, when I went to school, I couldn't read. And I dropped out. And now he's just doing odd jobs. And he said, I work when I can, but I can't read. I can't fill out these applications. And so I think we do have that population that we need to reach in school while they're in the school setting, before they get to that point, because now it's going to be so hard. And he told me all these stories about going to fill out applications and how frustrated he felt. And he said, in my day we didn't get tested, so he doesn't know if he has a learning disability.
Right.
And I don't know what the situation was when he was growing up in the home, but if he didn't have anyone to reach out to as a teenager, or even younger, obviously, then it just sets up this whole domino effect that leads to homelessness. And then it's harder to deal with. So I really think while we do need to focus on those people that are homeless now, we can't forget the children. We can't forget our school system. And what can we do to help that? And even before that, public health has grant programs now that focus on early intervention. Project Basita, Project Carino, and these are projects that look at 0 to 3, 0 to 8, and they've presented to our volunteers.
Right.
So our volunteers will actually have brochures for these different projects, and public health was really excited and said, if you can make referrals for people in need that meet this criteria, and so all those families I was talking about, we can make referrals. They can actually, one of the programs does home visits. They send nurses out and caseworkers to do evaluations. So there are a whole number of different types of programs out there.
And
we will have brochures. We have
Okay.
a whole list, Oasis, for
Well,
people
and I do think that is a large part of the key. Well, you mentioned home visits, or place visits
Right,
for folks that don't have a home.
exactly.
Because transportation for the folks in the lowest economic circumstances is such a huge thing. Yes, I'd come to PTA meetings if I had a car.
Right,
Yes,
right.
I'd go get these services if I had a car.
Right.
Yes, I'd checked out this brochure if I could read it. These are all things
Right,
that, if you
right.
can get these services to these areas would make a huge difference.
Right, exactly. And I think that awareness is important.
Margaret Hattori is with us this evening. Dr. Margaret Hattori from the University of Guam. She's the interim head of the nursing department at the University of Guam. But tonight we're talking about the homeless count, the homeless point in time count, and the information gathered there and how it could be used to help tackle Guam's homeless problem. We'll be back to wrap things up here on Good Question right after these.
I like that.
Yeah, I like that. You gotta like that.
What's not to like?
Like. I like that. Ooh, I like.
Oh, I definitely like that.
That too. I like that one.
I like it. Like, that's weird.
I like this. Yeah.
There's a whole lot of liking going on. That's right, we're too cool not to like. Like us on Facebook today. What do you like?
I like it.
I liked that yesterday.
And thanks again for joining us on Good Question. My name is Travis Coffman from News Talk K57's The Big Show on 570 AM and on Guam's own Fox 6. Make sure and catch us every afternoon. We've taken our show to TV, to you, so that you can hear more about the homeless count. And frequent guest in our radio program, Margaret Hattori, has joined us as she works at the University of Guam. Her day job, but as far as this homeless count and this gathering of homeless information, she's agreed to join us on the program tonight to give you some information so that you can perhaps help out. Now, there was a number and some information about some training that you wanted to add, Margaret?
Yeah, we still have training that's going on this week and next week. So January 14 and 15,
okay,
we'll have training. And it's at the Catholic Social Service Conference Room in Barragata.
Okay.
If anyone's interested in either the training or in donating canned goods,
okay,
because we still need the canned goods, they can call Amor Say from Gura, and the number is 475-1406.
475-1406. Okay.
And Amor will get them in touch with the person that's actually coordinating the training.
Okay.
And so that would be wonderful. We really need adults, not minors.
Right.
Right. Because we do frequently get high school kids asking if they can volunteer.
Right. I'll be happy to ask the homeless people questions. You're like, no. How about no?
Yeah. So adults would be helpful.
Now.
Oh, and I'm sorry. The count is actually on
Yeah,
January 24th.
I almost forgot
Friday.
that part. Thank goodness you're here. That's right. That's why she's at the University of Guam, because she's just that good. Okay.
So it's January 24th.
From when to when?
Well, the morning teams in Agana, we start at 4 a.m.
Woo, really?
Right. We start at 4
How
a.m.
come?
Well, some of the homeless, particularly in Agana and Anigua, will leave when daylight hits.
Right.
They'll leave their sleeping area, whether it's at the beach or in a park. And so we need to catch those individuals before they leave the area.
Oh, I see.
If we get there too late, and this has happened in previous years, we get a lower count. And
I see.
And we miss them. And then we have to try to track down where they are. So it's much better if we get them where they're sleeping. And then we really know, we get a good idea, we can see the sleeping situation, and we can get a better idea of what they're going through.
I see.
And when we go into the other villages, though, we will start at 7:30 and head to some of the other villages at 8 o'clock. So it really varies depending on the village that we're going to.
Well, I tell you, this has been very interesting. And Margaret, I thank you so much for joining us here on the program. Thanks so much for participating in this and helping to reach out to the community to help us deal with this particular situation. A lot of people raise their hands about the homeless problem and say, what do we do? Well, it begins with a single step, and this could be it. Thanks so much again for coming, and thanks for joining us tonight on Good Question.